This video will be discussing the topic of trauma, including different types of trauma and the adverse effects. If you need any support regarding a traumatic event that you've personally experienced or advice supporting a child with trauma, please see the guidance in the description below. Trauma in children is the result of an event or a series of events that can be harmful or life-threatening. This can affect the child's ability to function or cope. Although trauma is unique to the individual, it can lead to lasting, long-term emotional, psychological and sometimes physical effects. Childhood trauma can result from a variety of distressing experiences, which could include abuse, including sexual abuse, neglect, loss of a loved one, accidents, or exposure to violence. Hi everyone, I'm Zoe from My Progression, and today we will be discussing how to work with children who have experienced trauma. Trauma-informed practice and education focuses on understanding the impact of trauma, supporting affected pupils and creating inclusive, safe environments for all. This approach begins by understanding that a child's experiences in their early life can have a profound effect on how they view the world around them. Trauma-informed practice acknowledges the need to see beyond the behaviours a child is presenting and to ask, what does this child need, rather than what is wrong with them? Here at My Progression, we aim to provide educators with all the tools they need to support their pupils, from academically to socially and emotionally. We strongly believe that being aware of sensitive topics is a vital part of your career, especially when working with vulnerable children. For more information on this, check out our video on how to talk to pupils about sensitive topics. For more from My Progression, hit like and click on the bell so you never miss a new update. So, what is a traumatic event? According to Young Minds, a UK mental health charity, these are some examples of things that a child or young person could find traumatic. These are things such as experiencing domestic violence or abuse, discrimination including racism, homophobia or transphobia, being bullied, the loss of a friend or family member, going through a serious physical illness or spending time in hospital, experiencing an event such as a car accident or a natural disaster, or being exposed to frightening or inappropriate online content. It's really important to mention that different events may be traumatic to different people. Trauma depends on how it makes someone feel, and there's no specific list of events that are considered traumatic. For more information, Young Minds is a great resource to support both schools and parents on how to support the well-being of a child. Check out the link in our description below. Traumatic events are known as adverse childhood experiences. Throughout this video, I'll be referring to them as ACEs. ACEs refer to traumatic events that occur in childhood and can have long-term effects on a young person's health, well-being and development. When I personally received training on ACEs, I was so surprised to hear different events that are considered traumatic and how common they are. An NHS study actually showed that 48% of children have experienced at least one adverse childhood experience. So how does trauma actually affect child development? Well, from birth, our brains form connections based on our experiences. When babies are looked after and nurtured through positive interactions and physical affection, they feel safe in the world around them. However, when a child experiences trauma, the opposite happens. They build up connections in their brain about a world that feels unsafe. Therefore, even in environments that should help them feel safe, such as schools, children who have experienced trauma may still feel on edge and even distressed. So, what are the signs of trauma in a child? Well, in school, children who have experienced trauma may struggle with learning, managing their behaviour and building relationships. All school staff play a critical role in supporting these students by creating a safe, structured and understanding environment. Now, children may not always verbalise their distress, but trauma can manifest in many different ways. As school staff, it's important that you can recognise signs of trauma to provide the necessary support and intervention for children who have been impacted. Firstly, regarding their emotional state, you may recognise a child experiencing anxiety, sadness, mood swings, fearfulness, or difficulty regulating their emotions. Around school, a child who has experienced trauma may display aggression, withdrawal, hyperactivity, defiance, or struggle with forming relationships. Now, trauma can also impact a child's academic success, leading them to struggle when concentrating, having difficulty retaining information, or purposely avoiding certain topics. Physically, trauma may present in a child through fatigue, the child reporting frequent headaches and stomach aches, or exhibiting hypervigilance, where the child often appears on edge. In some cases, children who have experienced trauma may experience mental health difficulties. This could lead to a diagnosis of anxiety, depression, or post-traumatic stress disorder, known as PTSD. For more information on PTSD and complex PTSD, CAMHS, NHS's Child and Adolescent Mental Health Service, offer great advice, and their website is linked in the description below. So how can you create a supported environment for these children? Well, educators and schools have a vital part to play in supporting a child or young person who has experienced ACEs. A trauma-informed approach focuses on supporting children who have experienced trauma by all staff having a good understanding of the impact that trauma can really have. Following this means that school staff are supported with dealing with challenging behaviour and pupils have a balance of understanding and clear boundaries and expectations. Using a whole school trauma-informed approach is going to be essential to support your pupils with ACEs. This is made up of 3 key aspects. The first of these is safety. If a child does not feel safe in school, they will not be able to learn effectively. This links in really well with Maslow's hierarchy of needs, which states that basic needs, including safety, need to be met before other needs can be fulfilled. Schools can create this safe environment by reducing the number of triggers in the learning space to allow the child to be able to access learning and play. All school staff should be aware of any triggers particular pupils have and strategies to de-escalate and calm them. As well as this, children in school should have a clear routine and expectations, with plenty of notice given if there are any changes in their daily routine. The second aspect is emotional literacy. This includes the ability to understand, express and cope with emotions. From their early years throughout their school life, children should be supported in developing their emotional literacy. Generally, this is a skill that will develop as a child grows older. However, children with ACEs are likely to need explicit teaching to develop the skill of recognising their own and others' emotions. To do this, you could help a child label their emotions using phrases such as, "You seem happy today because I can see that you're smiling," and a range of games to explore what different emotions look like. To teach pupils about empathy, use stories as a resource and ask children questions, for example to encourage them to make inferences about a character's emotions. The third and final aspect is relationships. It is essential that every child has trusted adults in their life. These are adults who a child trusts to help them develop in different ways, including someone who they can open up to and share any worries or concerns with. However, if the traumatic event the child experienced involves someone breaking their trust, then it is likely that new relationships will be harder and slower to build and maintain. Regarding children sharing their trauma, it's important to remember that trusted adults will often have disclosures. This means that a child will share sensitive information with them. This will need to be logged following the school's safeguarding policy. For more information on safeguarding, watch our 3-part CPD accredited series, detailed in the description below. A trauma-informed approach is an ethos that impacts every single relationship in school, beyond just that of teacher to student. It can extend to what support teachers might expect, especially when dealing with challenging behaviour, as well as their well-being and sense of safety. That must also be considered. Trauma in children can be the result of distressing or life-threatening experiences, such as abuse, neglect, loss, or exposure to violence. These experiences can have long-term effects on a child's emotional, psychological, and physical well-being. Trauma can alter brain development, leaving children feel unsafe and constantly on edge, even in nurturing environments like schools. Children who have experienced trauma may struggle with learning, emotional regulation, and relationships. There's no specific list of signs of trauma, but indicators could include anxiety, aggression, withdrawal, concentration difficulties, and physical symptoms like fatigue or headaches. As educators, it is vital that you know how to recognise the possible signs of trauma and how to support your pupils who have experienced it. Overall, using a trauma-informed approach in schools is essential for supporting children who have experienced ACEs. A whole school trauma-informed ethos will help both children and staff navigate behavioural challenges, creating a safe and supportive learning environment. For more information on trauma, including how to support yourself and young people, along with the other resources mentioned throughout this video, please see our description below. I've been Zoe from My Progression. Let's keep your career in motion.